Uh, Hi everyone. I'm sorry that this session got delayed. Uh, but whatever time, and just to tell you this, that since Satakshi's company Ecobits is one of the sponsors of this event as gift partner, and I requested her that she should write a lot about me, like bit exaggeration, but she said no. And she told me that since the people sitting in this event or the guest speaker are way above your what you have achieved, so we cannot beat that kind of stuff. But what I can tell you is that even though they have larger experience in their life, but I do come from very diverse set of background, and in the next 50-20 minutes I will make sure that you get to understand why today is probably the best time in the history of humanity to build something on the AI in healthcare, and why probably this place is the best suitable to build something at that larger scale as well. So this speech is the part of India and AI, a Hope for Universal Healthcare Summit, and this is pre-summit of Impact under India AI Impact Summit 2026. So, even though the key themes of this talk is ecosystem, AI, and healthcare. But what I have realized in life is that you have to also understand the macroeconomics or stuff that generally plays out in this world. So for me, the biggest revelation in my life was when I got to know that humans, or we, are a combination of trillions of cells. And we have evolved from single cell to this complex human in the past some 3.8 billion years. And when I got to know this, I was like amazed by the fact that, oh wow, if with time duration a single cell species can get evolved into this human function, what is there to consider as impossible? But we do have some evidence, as we all are like engineers studying in IITs, you all are, I'm not. We also have evidence before that. So I mean the age of this universe is around 13.8 billion years, and from there to single cell species to multi-cell species, and we have recorded history of Homo sapiens of around 300,000 years. From that time to again getting into this called prehistory of 2,000 years and having historical record of 5,000 years. So to understand or make sense, we don't have the record of the historical context that we all look out from our civilization point of view. We only have record of 5,000 years. Now, if you look at this journey from Big Bang to what we are today, the most of everything that you see around you, everything, has come in the past 200 years. And that has through three major revolutions: agriculture, industry, information, and now we are into this fourth one called intelligence. Now, to understand this, the global nominal GDP means gross domestic product, that's a way to understand, it's a unit, it's like to measure the progress and activity in the human civilization. The GDP in 1990 was around $22.95 trillion. However, GDP in 2025 is $113.8 trillion. That's 5x in just around 35 years. Now imagine the entire civilization of billions of years, and you have this 25 years or 35 years. We did so much of progress, and that is one of major reason is this some revolution called information revolution that we call IT revolution for short. Now, as there was Big Bang, which was very simple point form, but as it got complex form of galaxies, stars, and what we do today, digital world also get complex as well, and that leads to the exclusion of direct involvement of humans, billions of humans. For example, when agriculture revolution took place, anyone can go and become a farmer because there was no barrier to entry in that part. When we have this industrial revolution, semi-trained workers could go and work in assembly and manufacturing. There was low barrier. But when information revolution come out, it created very high barrier in the human, and therefore billions of billions of humans got excluded from the direct contribution. I will come to this point of fundamental and why, what is the contribution of Indian from this one, will later on this one. Now, of course, we have made unprecedented progress. There is no denying the fact. But the system has also got complex and excluded billions of humans. Just to give you a sense, that in the past 65 years, the average human lifespan got increased by 65%. But if you look at, go and ask that, hey, what is the supply side of healthcare? We have number of shortage of beds, hospitals, doctors, and every other equipment that you can think of. This tells you something very specific, that even though progress has been made on this all complexity, but somehow system needs to get into the simplified form as well. Now, to give you a sense, better sense, I mean, all of you can understand. So, in the entire human workforce, developers consist of 0.35%, just 0.35%, and that tells you the complexity. Of course, for agriculture, for industrial manufacturing, there is still over 50%, but from developer side, only 0.36%. And from healthcare side, it's still limited, it's 0.86%. When things get complicated, complex, when humans get excluded from direct involvement, then things has to be get simplified. And something amazing took place in 2022 when ChatGPT got released. That was the first time when you can, or human can essentially talk with a machine in natural language and get the most of the complex answer done. That was mind-boggling from the point of view, because even though the AI research got started 60 years back, however, it took around this one to understand that human can speak to machine in their own language. All of you will sort of understand these two simple examples. Let's say if you need to build a website, so the website that we built for this AI summit, if there was no AI, it would have taken around at least 5-6 days, 100 hours of work, front end, back end, 10,000 lines of code, connecting that with database, everything else as well. However, the prompt that I used is this: design me a website for AI Summit with title this, make sure to save the database, it should have registration form, partner management, and create an admin so that I can manage everything from one side. Also make sure to connect with Supabase database, everything done. And I wrote this simple prompt and my entire AI Summit website was ready. So imagine from being such a complex system to being this simplified version of this AI machine and human interaction. That is brilliant, because what the next coming is going to be the biggest decider of the human fate. This is very relevant from healthcare point of view. When there was no AI, imagine there is no AI, of the AI that Jilo Health has built. For Ruben Hospital to conduct a health camp in remote part, let's say Rajgir, they need doctor. Of course, doctor per hour expenditure is very high. I mean, they have traveling expenditure, etc., etc. So to even conduct a health camp, they have to think 2 times before taking the decision. But when we build this AI screening tool, a trained paramedics, even an ASA, can take the tool, measure all the vital, feed in the system, and generate the risk of almost as accurate as any doctor will do, and send the report directly to WhatsApp. So this is what the complexity, from complexity to simplicity, we are going into with the AI revolution. Now, if you look at the history, if you look at everything around you, is built by someone like you and me. I actually wanted to write something else. I wanted to write, is there a God? And I want to say no God. But if you look at this world, it is influenced by human. And if you're going to say that, you are probably wrong. Because this world is influenced by few humans, just a few. Every single policy that you see, every single thing that you are seeing is influenced, controlled by someone. And when that is the case, imagine a technology that is going to change this world, and if your voice, if our voice is not included, not consulted, I can tell you for the fact that most of the 65-70% of healthcare delivery get delivered by these semi-hospitals, smaller hospitals, but no suitable tool get built in their consultations. The 50% of India's population still don't get considered while building these tools that is essentially being used to solve their problems. And that is bad. That is bad because when you are not taking the steps to add your inputs, that is bad. And therefore, we all need to think that how can we put our own voice in the policy or in the shaping of this technology that is going to change the world for the better. So now let's come to the AI part. Whether we believe it or not, whether you can see it or not, people in control can already see it. The builders who has built it can see it, that AI will change every single industry that you can think of. That's education, that's entertainment, that's retail, everything, that's manufacturing. But what I personally believe is that AI will have massive impact, positive impact on healthcare. The reason is because healthcare needs such kind of technology that could sort of minimize the dependency on trained, high-skilled workforce. But what I believe more is that AI alone will not be sufficient. It will be human plus AI, and that system will be a universal healthcare. And again, when I say universal healthcare, it will probably come from India. The reason is because if you look at the GDP per capita on healthcare, India is already 150 times lower than the US and 10 times lower than the China. But our quality of delivery is way better in many of the aspects compared to these two developed countries. And if that is the case, imagine the possibilities that we can create. We build AI which is aligned with humans and see the magic. In history, we have been exporting stuff. This will be the first time when something will build in here and will get exported out. And that is something I sort of aspire every single day. Now, I have realized is that when you use big words like universal healthcare will come from India, people sort of find you delusional. I mean, there is nothing wrong in that. You can consider me delusional. But the fact is that our nation or India has already sort of has success story on many of the fronts. For example, WHO already recognized ASA as the biggest health contributor in this world. Just to give you a sense, India's 65% of maternity care is delivered by these frontline workers. They are not even the employee. So they get paid per hour. Now, if we can train millions of ASA and get the very critical part of healthcare delivered, now imagine you give these AI tools, build in consultation with these frontline workers. You cannot think the revolution that it will create, and the AI plus human equal to universal healthcare from India is very much possible. Just to add this, that healthcare is not limited to doctor or into hospitals or clinics. Across the industry, of course, when we say health tech, it already goes into the AI part, it already goes into the technology part. But healthcare has been intersecting with many of the other domains as well. For example, IIM Udaipur has Center for Healthcare. It's Section 8 company focusing on how can scale these population levels health tech solutions. There's something called Charak, that is again a health tech focused center inside IIT Indore. There is Majumdar Sao Innovation Center Fund, that is technology business incubator, really focused on medtech and health tech startups. Imagine these big corporates with already billions of dollars of revenue and profit are getting aligned with or finding intersection with this one, which tells you something very important, that healthcare is not at all limited with doctors, hospitals. It is already structuring. Now, as we talk about the innovation, as we talk about the AI-led healthcare, it is the combination of four. First, start with the technology part. If anyone is building in healthcare in AI, that is probably everyone knows incubator comes out, most of the startups comes out. But that is not at all enough, because when you're building something in AI plus healthcare, you also need researcher on AI that you can only get from academia, institutions like IITs and other AI-led institutions. Once you have that, then you also need medical colleges to get clinical approvals. That is important. And once you do all these, then you need to connect with public health to scale it. So thinking healthcare in just healthcare would be a big mistake. Now, this would be the super relevant for anyone building in health tech or in health in AI. Let's say if someone is building in other industry, let's say you're building in probably in SaaS, software as a service. So what you're gonna do, you're gonna go find your idea if you already have idea and build MVP. Once you have MVP, you essentially go and test with users. That's it. Building MVP might take, let's say, 5 months, 6 months, awesome. But when you're building in health tech, the game is totally different. Once you have idea, you are building MVP. Now you go and consult or talk to medical college. Talk to their ethical clearance, submit the approval, get the preclinical study done, publish the research, then maybe get some pilot, and then get certification, and then start deploying. So the difference is stark. And if we are not understanding that fundamental of how health tech businesses are being built, how the lifespan is different, it would be very difficult to even sustain the innovation that we all are looking at. Now, imagine this. So Jilo Health identified a new problem, that how can AI use science the way doctor use. Of course, the idea come from my mentor, Dr. Kamlesh's discussion. How can AI use science of face, eyes, and palm and identify diseases? Now, once this idea is there, the second step would be to build that model. Imagine we build a model in 3 months. Awesome. What next? Of course, what next? You're going to probably go and apply for incubation because you have some prototype of that solution. So you can either go in APIIC because they are our sponsors, so we have to take their name first. And you can also go to IC because they're also like amazing incubator in there. So once you consult them, once you get incubated, you will probably take a couple of more months or maybe a couple of more quarters to get your MVP done. Now your MVP is done. What next? Now, but imagine if while building this, you also got problem, like the AI model that you were building in prototype, in MVP phase, you got problem like you are not getting the accuracy. So you will probably go and consult researcher in IIT Patna who are in the AI and ML department. So you have IIT Patna. Once MVP is done, now what? You are essentially going to knock the door of EMS Patna. Of course, if you are incubated in APIIC, the process would be easier. You might get direct entry, but if you are not, it will take longer. So now you knock the door and submitted the project or proposal for ethical approval. You got that. You got your preclinical study done. Awesome. You published the research. Great. What next? Now comes Ruben. Now you have built it, so you have to get paid pilot. At least that will be validation for investors to sort of pat your back and say, take this money. So you reach out to Ruben and said, sir, हमने ये बनाया है, we need your help. We have already all the certifications. Awesome. Ruben gave you this one. This is how health tech startup or health in AI startup get built. And this ecosystem is only existing, fortunately, in Patna. Only. Now, in 35 kilometers of circle, if you look at, you have APIIC, you have IC Incubation Center in IIT Patna, you have IIT Patna, you have GIM, other public medical college, you have EMS Patna, and you also have other private hospitals. Now, if you circle this back, if you make the circle a bit bigger, like 65 kilometers, then many of new private medical colleges will add into that circle. Awesome. Now make the circle of 100 kilometers. Now you get IIM Bodh Gaya. You get IIT Bhagalpur, and many of 5-6 private medical colleges that are in pipeline to get into this one. So this place is the only ecosystem that exists to sustain ecosystem for AI in healthcare. And when we say Patna can be an ecosystem, what we essentially mean is that Patna or Bihar can be a factory of AI-led healthcare solution for the world. And therefore, we would be sort of getting this ecosystem built in consultation with every stakeholder that I talked about. Apart from these institutions, private hospitals, what we also have is very culturally aligned population. So we sit in the middle of Jharkhand, Uttar Pradesh, MP, other states, which are still very underserved and supply constrained. So once we build here, we have this opportunity to scale for 500 million Indian, and then for the rest of the world as well. Now, from day zero when we thought about this event or this summit, and in fact I remember now Bhanu Pratap, the director of Mediversal group is here. We tried something last year, but we failed. But this year, this is what I'm going to lay out to all of you, and of course the decision maker as well. What we really believe is that we have once in a lifetime opportunity to build something from Patna that will be used not only in India but for the rest of the world. And if we are getting aligned on the same page, these are the few things that we need to do. A, we need to come on board for something called not-for-profit organization, and I can tell you why. When we reached out to Impact AI Summit for pre-summit approval, they said, we have approved your event, but we have not approved your fund, because that is a government organization and they are mandated to give money to only non-government organization. So if there had been a such kind of at least ecosystem of Section 8 company or something like that, we could have got money from them as well, and our ability to execute this event would have much better. We also believe we need 10 medical or technology business incubator in Patna, around Patna. And those incubators should be professionally run, not for the numbers, but for outcomes. These incubation centers should also be recognized nationally by DBTI or other AIC or other centers that recognize and give fund. Because if we can do that, the ecosystem example that I gave you will combine this, building the factory that can generate AI-led healthcare for Bihar, for India, and for rest of the world. And thirdly, collaboration. I'm not sure how many of we collaborate in general, but I hope that after this summit, not only the students, participants, Ecell, medical colleges, EMS, we somehow find time, figure out how can we build this something together. So with this, I have just this is very dedicated to students. Again, I mean, I'm not from IIT, so I sort of can tell you that you all are a lot more leveraged with the resources that you all have. And I will repeat the sort of paragraph that I used in my keynote during inauguration, that this world is very noisy world. You will probably need to speak louder if you want people to hear you. And you cannot speak. I mean, you go and shout, they will ignore you. So you essentially have to figure out your own ways or method or path to make sure that whatever you care about, whatever you believe in, should get heard, so the action could be taken. Because I can tell you, I sit in Patna, and when I review these health tech startup or the incubators or the funds stuff, I get very fed up, or like sometimes get frustrated, because they don't even consider the half of populations. They don't even consider the hospitals or the healthcare fraternity that are existing in this world as well. And therefore, this event is our method of our ways to amplify that that we deserve to be consulted for the solution that is being built somewhere outside. We deserve to be recognized that we are also the consumer of the solutions built outside. And not only that, now this is a time that we build. Of course, the path is going to be difficult, but we must collaborate and we must build. So find your voice. This was my voice, and thank you so much.
Please go out and arrange the panel discussion 1 hour.